So again, my name is Annie Schmidt, and I am with the National Alliance to Advance Adolescent Health. We operate GOT Transition, which is the National Resource Center on Healthcare Transition. And so first, just our funding information. We're funded by the Maternal and Child Health Bureau, which is within the Health Resources and Services Administration of the U.S. Department of Health and Human Services. First, I'm just going to give a little bit of background about healthcare transition, and then I'm going to be asking Erin questions about her own experience with healthcare transition, and we'll summarize some resources that we have available for families. So first, some overarching goals of healthcare transition are to improve the ability of youth and young adults to manage their own healthcare and effectively use health services. And we're talking about youth both with and without special healthcare needs. A second goal is to ensure an organized clinical process is in place in both pediatric and adult practices to facilitate the healthcare transition preparation, transfer of care, and integration into adult care. There is evidence that when a structured healthcare transition process is in place, youth with special healthcare needs are more likely to show improvements in health. This includes improvements in adherence to care and quality of life, as well as improvements in patient experience, including patient satisfaction, as well as decreased perceived barriers to care. And lastly, it can lead to improvements in utilization of care, including decrease in hospitalizations, shorter length of hospital stays, and increase in visits on the adult side with the adult healthcare provider. There are these three professional organizations are the American Academy of Pediatricians, American Academy of Family Physicians, and the American College of Physicians. These three organizations in 2018 released a clinical report on healthcare transition, where they recommend that all youth with and without special healthcare needs receive a structured healthcare transition process, which is called the 6 core elements of healthcare transition. And this is the process that facilitates the preparation, transfer, and integration into adult care. So when we say preparation, we're talking about what happens on the pediatric side, which includes learning how to manage your own health and healthcare, understanding what age you'll need to transfer to a new adult provider, having the doctor create and share a medical summary with the young adult and their family. The transfer of care is the actual move from the pediatric provider to the adult provider, while making sure that the adult provider receives all of the necessary information about the young adult, including their medical summary. And then the integration is what happens on the adult side. This is the process of welcoming and orienting the young adult into the new adult practice. I'm going to show a brief video that we put together that just gives a background and overview about healthcare transition.
For many young adults, transitioning to adulthood can mean going to college, finding a job, or moving out on your own. This can be exciting, but also really challenging. One transition that you may not have thought about is healthcare transition, or HCT, which means moving to an adult model of care where you are the main person in charge of your health. HCT is not a single event. It's a process that can take several years. Learning about your own medical history is the first important step. So ask your doctor how to access your health information. A major part of HCT is learning to manage your own health and healthcare. To start, you can make your own doctor's appointments, fill your own prescriptions, and talk with your doctor alone. After you turn 18, your doctor can only legally talk to you about your health. Your health information and medical records will be kept confidential. It is up to you to make your own health choices. You can decide, for example, if you want your parents to see your records or be in the doctor's appointment with you. For those who see a pediatrician, HCT also means moving from your pediatrician to an adult doctor. This usually happens between the ages of 18 and 22. Some people see a family physician or a doctor who sees patients throughout their life. If you see a family physician, you'll need to change who makes your health decisions, but not your doctor. In an adult model of care, you, and not your parents or caregivers, are in charge of making decisions about your own health. To plan for this transition, talk to your doctor and ask them about their policies. If you see a pediatrician, ask them when you need to leave their practice. You can also ask them to help you find a new adult doctor to move to. HCT is all about independence and empowerment, so be proactive. Find an adult doctor who is accepting young adults into their practice and takes your insurance. And don't forget to encourage your friends to be proactive about their healthcare transition too. For tips and resources to make your healthcare transition as smooth as possible, go to gottransition.org.
Okay, so that was just a little video giving, again, some background and an overview of what healthcare transition is. We do have it available in Spanish on our website as well. So we encourage you, if you would like to share it or watch it again, it's available on our website at gottransition.org. And so now what Erin and I are going to present is a new family toolkit that we created with our family advisory group. We have 10 organizations that are represented on this group that are listed here. So Erin represents SPAN on that group. And there are just links to the family toolkit in both English and Spanish. So we want to just summarize what is included in the toolkit, which has 10 resources to help youth and their parents or caregivers throughout the transition from pediatric to adult care. And the goal is to hopefully help answer some questions that families might have about transition. And so what I'm going to do is we're going to walk through each of these questions. I'll ask Erin to share her thoughts, and then I will summarize a relevant tool that is included in the family toolkit. So here, my first question for Erin is, when should my child and I start to think and talk about transition?
So in my humble opinion, the sooner the better. It is never too early for us as parents to foster self-advocacy and encourage our children to speak up. I think especially about their own bodies, especially for girls. The toolkit includes, a wonderful timeline. And that timeline begins at age 12 and goes through age 25. It lists suggested activities that might be age appropriate to start your healthcare transition journey. But keep in mind, these are just suggestions. You know your child best. Think about their individual needs, their own specific healthcare issue, perhaps their developmental and personal comfort levels when you're thinking about some of these suggested activities. I think that it's important that, some children at, say, age 12 have a really good understanding of their own healthcare needs and their disability, whereas others may have a very limited grasp, or maybe the family hasn't explored the full implications of their specific healthcare needs. So, but regardless, it's important that children know that it's okay for them to speak up, because again, going back to that, this is their body. Please note, healthcare transition is for all children. The initial activities might include just having your child go up and sign their name when you arrive. It might include trying to direct the doctor to ask your child how they're feeling rather than you when they're in the room. As they get older, again, you might think about other activities such as having them pay copays, making appointments, managing prescriptions, even like, getting on a app, or if your physician or pediatrician has something like My Chart, looking at their own records. Another activity might even include having them learn to set alarms for their medications, or even vitamins if they don't take medications. These are all activities. Annie is going to review some more structured activities and the timeline on the next slide.
Thank you. If we can go to the next slide. Great. Okay, so the first resource that we have in the toolkit is a healthcare transition timeline, which has some helpful steps to take at different stages of the transition process, which starts at age 12 and continues through age 25. Dawn, if you could just hit the next arrow. Yeah. So the first age bracket is age 12 to 13. So just one example that comes from the timeline is a parent or caregiver could encourage your teen to ask their doctor questions about their own health. And if you could go to the next one. And then the next age range is at 14 to 15.
Other way.
Yeah. Yeah. So at 14 to 15, you could help your teen practice making a doctor's appointment and ordering their own prescription refills. And then at 16 to 17, you could work with your teen and their doctor to make and share a medical summary. So that's what I mentioned earlier, that the pediatrician can work with the youth to create this medical summary and then make sure it gets transferred to the adult provider. And the next age range is 18 to 21. You can encourage your young adult to ask their current doctor to help find a new adult doctor while making sure that the new doctor accepts your young adult's health insurance and helping them to learn if there will be any charges at the visits. And the last age range is 22 to 25, where you could encourage your young adult to get care from their adult doctor, to learn to manage their own health and healthcare and update their medical summary. So these are just a few examples that come from the parent caregiver version. Each of these age ranges has between 3 and 5 steps, and there is a youth version as well that has similar steps. They're just worded towards the youth. So if you can go to the next slide. My next question for Erin is, what are the recommended healthcare transition services?
So, hi, one of the things that I want to share with all of you is that this toolkit that's came about has been the result of many years and many people striving to improve the outcomes for children with special health care needs. And you've heard Annie refer to our 6 core outcomes for healthcare. And many years ago, there was a survey, I think around 2006. So I think you guys, when I say it's taken a long time to get us here in these tools, I have to just tell you, it's a lot of people have been working for this. And one of those outcomes they measured was healthcare transition from pediatrics to adult providers. And of all the measures that they had, that was the worst outcome, where they didn't make the most progress. And because there's a lot of barriers, especially for children when they do have special healthcare needs, to again make that leap from pediatrics to adult practices and specialists. One of the things that was important, though, is that the clinical report that you've heard Annie reference a few times, and you'll see in the slides, when that came about, it wasn't just recommendations for all children, but it also gave providers and doctors tools, algorithms, age appropriate steps that said you have to have a plan starting at 12. So the burden is not exclusively on the parent. Your doctors and the parents and the youth are to be partnering. One of the things that you'll see in here, we're going to put in the link to that report. For today's time's sake, we don't have, we're not going to review that, but I would encourage all of you to look at that. The key points are that there has to be a plan for all children beginning at age 12, and that they need to take those steps, and that the family, the parents, and the youth are equal partners in this healthcare transition process. Annie?
Thank you. So Erin gave a perfect summary of what the clinical report is. So in the toolkit, we have a one-pager that has the link to the clinical report and gives a summary of the recommendations that came from the professional organizations, which are the American Academy of Pediatrics, American College of Physicians, and American Academy of Physicians. And so as Erin was saying, they provide guidance for what services providers should be giving for all youth with and without special healthcare needs throughout the transition process. Again, including that the planning should begin as early as age 12. Doctors should help youth and young adults learn to manage their own health and healthcare, including scheduling their own appointments, filling their own prescriptions. Doctors should discuss changes that happen at age 18 in terms of privacy and consent, and the actual move should happen between the age 18 and 20 and early 20s. So that just gives an overview of what's included in the clinical report, but I also, as Erin said, recommend or suggest, if you're interested in the full guidelines, you can access the clinical report. Next slide. All right, so Erin, next question. What questions can my child and I ask our doctor about transitioning to adult care?
So one of the reasons I put a little emphasis on that clinical report is that all of you know, often you go into the doctor's office, the room is packed, you have very little time. I think that having that report, again, as a go-to for parents is empowering to say, this isn't something additional I'm asking you to do. This is what's supposed to be recommended by the American Academy of Pediatrics. And so when we start talking with our children about, asking questions for their doctor, it might be a little intimidating. They've never done that before. The doctor might say, little questions, if you come in and they have a cold, but healthcare transition is a little different. One of the things that we want to start thinking about what's going to be different from just the typical pediatric model, when mom comes in and tells the doctor what's wrong, and then the doctor checks Johnny's, chest and vitals and all that. These are very different steps than that. One of the first really important questions is, when is it appropriate for my child to be roomed alone? That in itself puts some mothers and fathers into a panic, because the idea of their child alone with the doctor, is scary. This isn't all or nothing. You may want to just think about, again, the youth's comfort level. One of the things I did with my own sons when we began our journey of healthcare transition was I would go in to the room, would sort of give a brief reason of why we were there, and then I would step out and I think that when you think about even just a basic physical, that's a great opportunity to begin healthcare transition. Your child's had a physical before, they're going to do standard routine things, step out, walk back in. If the doctor needs you, they're going to call you. That's a good opportunity, and gradually go from there. This is not an all or nothing situation. And again, think about your child's, personal needs. Some other questions that I think are very important is the age. If you're seeing a pediatrician or a pediatric specialist, don't assume they're going to see you forever. You need to know what's their policy. I had, some are up till 18, some are up till 21, some go beyond that, especially if you have a unique healthcare issue and it's difficult to find adult specialists. However, don't assume. I want to share a personal situation I had with one of my own children with a neurologist. I came into a crisis at something that happened at school, needed it checked, called. My son had just turned 18 years old. Never in my wildest dreams would I have imagined when the nurse called me back, because I knew it was always difficult to get an appointment, but this required something quickly. I couldn't wait 2 months. I was told, she said, "I'm really sorry, Mrs. Say." She said, "We just realized that, your son has turned 18 and he needs to see an adult." And I said, "What?" And I said, what do you mean? I'm in crisis. This has been my son's doctor since he was 7. And I was stunned. That's why this is an important question. And I wasn't referred over to someone else. It said, call your insurance company. Well, we've all been there, done that. It's difficult to pick a specialist from a list, from your insurance company. And so that is an example of why healthcare transition is important, and why, if your doctor doesn't bring it up, you need to. That's one of the questions. I think that another important question is, when you do start to transition to an adult specialist, you need to think about some of their policies. What payments do they accept for copays? We have some doctors now who will only accept cash. That's an important thing to know. I have one specialist that I was stunned will no longer take checks or credit cards, and said, well, there's an ATM across the street if you don't have your $25 copay. Well, for someone with mobility issues, and let's say if it's raining or snowing, getting across the street in an urban area may not be that easy. So these are important questions. Also, do they do telehealth? Is that an option? Especially in places that maybe weather is difficult, or you have harsh winters. Another question you might want to think about that's extremely important that families don't think about when transitioning to adult providers: who covers you when you're on vacation or out? Where are they located? Those are just sort of a sampling of things that you want to think about when you're transitioning to adult providers. Annie?
Erin, can I say one thing before you move forward? I know we're not going to do questions till the end, but there are 2 questions in the chat box that I think that you can address at this point. So they're asking about, one person said, even for a young adult with an intellectual disability, you said step out of the room, even for a young adult with an intellectual disability and opposite sex doctor. And the other question is, what about a severely impacted individual with IDD and the parent is the guardian? It seems like that we're not talking about that population, but I know you are, so I wanted you to address that.
So on a personal note, I am a parent of children with autistic spectrums who are now young adults. And again, I think going back to what we talked, we just want to let you know, we do, there are tools being developed that are specific for youth who are transitioning with developmental disabilities. So, keep in touch with SPAN and Got Transition, those will come. I want to say, again, going back to this, and I've even had physicians ask me this question, well, I don't know what to do. I think you got to go back to the individual. And even if somebody has language issues and your comfort level, this isn't a test, this isn't a mandate. This is helping foster all of us, regardless of our child's disability, want them to live lives where they can make choices, where their voices are heard. I think that, we're going to talk a little bit coming down the slides about supported decision. Again, even if that youth isn't ready or not comfortable, then stay in the room. Again, these resources that we talked about, and I do want you to know, again, this is close to my heart because both of my sons have autism. And I know that I have to say sometimes, especially when they were young, the idea of them being solo without me was a little terrifying, because back when my son was young, if something was on the mind, it was out the mouth, no matter what it was. So, but I do want to say this, there's also something called the dignity of risk. And I think that it's really important that we try, regardless of our child's level of disability, to give them opportunities for independence and to have their voices be heard. And even for some kids, I know some parents whose children are nonverbal, they did some things like they had little pictures that have them give the doctor. It was like a little picture of them, where does it hurt? And sometimes they would use, as they got older, use their augmentative devices to communicate with the doctor. This isn't all or nothing.
Thank you. So the next tool that we have in our toolkit is called Questions to Ask Your Doctor. We have one version for parents and caregivers and one for youth and young adults. So thank you. So I'm just going to show an example for parents and caregivers. We have some questions that they can ask during their child's adolescent years. Which is a question that Erin mentioned. At what age does my child need to change to a new doctor for adult healthcare? And then there's also some questions to ask before transferring to the new adult doctor. Do you have any suggestions of adult doctors for my child to transfer to? And then we have a youth and an adult version as well that has some questions they can ask during their adolescent years, such as, when do I start to meet with you on my own for part of the visit to become more independent when it comes to my own health and healthcare? And as Erin was just saying, it does depend on the family. It depends on just the ability of the youth or young adult to meet with the provider on their own. Even if they don't meet with the provider on their own, a way to build independence is just to help make sure the youth or young adult has a voice and can answer any questions and can speak for themselves to the best of their ability. If you could hit next. There are also some questions to ask before making the first appointment to the new adult doctor. These are questions to ask of the new adult doctor. Do you take my health insurance? Do you require any payment at the time of the visit? And then the last, we have some questions to ask before making the first visit. These are questions to ask the adult doctor, such as, did you receive my medical summary from my pediatric doctor? So next slide. The next question for Erin: how does my child and my child's role change throughout the transition process?
So Annie, and I'm really glad that you mentioned the records, because when I spoke before, that's a biggie. When you're transferring, before you see them the first time, you want to make sure that they have your records. So thank you very much. I can't believe I missed that one. So this kind of goes back to the question that Dawn had spoke about. I want you to think about the goal of healthcare transition is for youth to gradually become the leader of their health, their own healthcare. Now, for some youth, some people may need support their entire lives. But again, when we think about wanting our children when they grow up to have lives of self-direction, let's support them to foster their independence as much as we can, as much as their ability, and as much as their comfort level. We have some youth may have comorbidity of anxiety disorders, or the question was, what if it's an opposite sex doctor and my youth isn't, my child isn't comfortable? well, then be there. You know, again, these things aren't set in stone. These are suggestions to get you thinking about it, to know that there's an obligation of your doctor to start addressing healthcare transition, because they are going to grow up. That's just the way it is. And so I think that one of the things that, you know, again, I think especially for people, and I want you guys to hear me out on this as a mother and as a parent, we know often that people with developmental disabilities and intellectual disabilities do not receive respect and equity. This is an important piece, that to support them in their capacity to let their voice be heard, even if they're nonverbal, to let them at least have, you know, some say so, to know that they're not talked about as though they're an object in the room. And so sometimes you might have to get creative to be able to foster that. But again, when we make these suggestions, it's just for your consideration, for your comfort level, and what you feel is okay. I think that, you know, that just allowing them an opportunity to have a say about their own body, or to express their own feelings, even if it's for 1 minute of that doctor's visit, again, it's empowering. It's an empowering feeling to know that my voice and what I say matters, especially about my body. Annie?
Thank you. So the next tool in the toolkit is this one pager that gives an overview of what a shared management approach is. This diagram just shows how the role of the parent or caregiver and the youth gradually change throughout the transition process. Everyone will travel through this at their own pace. It's again just a way to kind of see how the roles change, how the youth begins to take more control of their own health and eventually becomes the leader of their care. And so that's just this one pager. It shows this diagram and just gives a brief description of the shared management approach. I'll move on to the next question. What can I learn? How can I learn if my child needs help with decision making?
Well, fortunately, again, since we have, you know, began this healthcare transition journey, one of the things that we now have are many supported decision-making tools and resources. I would say as back as, you know, even 10 years ago, many of these tools weren't available. There used to be a presumption if your child had an intellectual or developmental disability that someone would have to be their guardian. SPAN and also Got Transition, and also Dawn's project, we have many tools on supported decision. And again, going back to alternatives for guardianship, again, this is so you can make informed decisions. You know, there's been a lot of conversation, you know, especially with the Britney Spears case. Again, but I think that's an example that someone who even has tremendous money and celebrity, how difficult, once you have someone adjudicated under, you know, as incompetent under guardianship, how hard it is to turn. So that said, you know, if guardianship is something that you have done, or you feel comfortable with, or you feel that your child really needs, then that doesn't mean, again, that these types of things are all or nothing. These are suggestions, and supported decision making, even if you have decided guardianship is appropriate for your child, or if that's already happened, that doesn't mean it's all or nothing. Please check out the supported decision making resources that we have. I think that, you know, youth may travel at different paces. And I remember I was doing a presentation once at Rutgers Law on guardianship and alternatives, and a judge said, think about where you were at 18. Think about then how different you were at 21, at 25, and at 30. So, you know, people's levels of support and what they need change as they grow. And that's going to be regardless of whether or not your youth also has a developmental disability. They're not going to be the same at 25 as they were when they were, say, 16 or obviously 12 when you started this journey.
Okay, next slide. So this is a tool that was created by Charting a Life course, which is at the University of Missouri, Kansas City. This is a tool to start exploring whether a youth, young adult might need help making decisions in 6 different areas of life that are bulleted here. One of them is healthy living, and I'm just showing on the slide what that section looks like. So you can a youth can fill this out either with their parent or caregiver or separately, and just respond to each of these questions about healthy living, such as, do I choose when to go to the doctor or dentist? Do I decide or direct what doctors, medical health clinics, hospitals, specialists, or other healthcare providers I use? And they can respond by saying, I can decide with no extra support, I need support with my decision, or I need someone to decide for me. And so there are questions for each of the 6 areas of life. And this is just a way to begin an exploration of whether they need help making decisions in any of these areas. Next slide. So Erin, what are some of the legal changes in healthcare that happen at age 18?
So again, and I just want to say, I saw a couple of the things, some comments in the chat. I just want all of you to know, these are resources we're sharing with you to, again, it's at your discretion what you think is appropriate. And, SPAN, we support families to, make informed decisions that's right for their family. We're not here to tell you what is right or wrong for your youth. And we may not have all the answers to every situation. Again, we're about empowering parents to understand, and youth to understand some of the options that they might have. So one of the things that happens at 18 is that regardless of disability, when you reach age of majority in the United States, your health, your rights revert to you. So if you have a child or youth who has complex medical needs, this is why the healthcare transition is so important. I can tell you shortly after my son's 18th birthday, was shocking. I had his medical power of attorney, but he had gotten a very serious illness and ended up in the hospital. And let me just say, thank God I had that, because initially when I went in and he was in a very bad place, he was very ill, he was unable to talk. He ended up, they would not have let me stay in the hospital with him had I not had some of these provisions put in place. And I did not do guardianship. That's not a judgment call as to those who have decided that's appropriate for their family member, their child. But I didn't. So the point was, he was 18. And at that point, had I not had been a little proactive and had his medical power of attorney, had him sign the HIPAA portability documents at his doctor, it would have made this terrible medical situation very, very difficult. And again, so one of the things that you want to think about is, and you have to know this, you can prepare before 18, but your youth really doesn't have the right to sign those documents until they are 18. And for those of you who are, again, have gone through with guardianship, that, there's planning involved. So I think the purpose of this that we want to really stress is that even if your child has significant needs, at 18, you need to think about, what is it that I need to do to ensure that my child, once they're 18, is going to get the level of support that they need, regardless of what that is. Annie? Oh, I'm sorry. There's one other thing I wanted to throw out there, that when we talk about medical power of attorney. Again, some people explore guardianship for medical. And again, we're not here telling you what you should or shouldn't do. We want you to think about options. But I think another thing that's really important that is not discussed is that for youth that have mental health issues, that one of the other things that can happen is you can have something called a psychiatric advance directive. And so that if someone, when they're an adult, become in a place that they need support, having that, what they call PAD or psychiatric advance directive, is a really important piece so that they get the needed supports if they end up in some type of a psychiatric crisis. And again, it's just another tool that you can explore. Annie?
Thank you. Next slide. So this is a one-pager that we have in the toolkit. It just shares a lot of the information that Erin just went over. It describes changes that happen at age 18 when the youth becomes a legal adult, in terms of privacy and confidentiality, what needs to be done if the young adult wants to share information with others. And it also links to the National Resource Center for Supported Decision Making. I saw someone entered that in the chat as well, that has some information that can connect you with resources in your state. And I do want to just sort of start to more quickly go through these resources just to make sure we have time to get through all of them, and leave a little bit of time for resources. So we'll just go to the next question. What are the differences between pediatric and adult care?
Well, some of them we've already discussed, because obviously when your youth becomes 18, the records revert, who has access to those records. Again, the toolkit also has some resources that can direct you and assist you in making sure that you have those resources in place. I think that the biggest piece is that in pediatric, again, the parent is expected to be responsible for all components of the child's health. Whereas an adult, the expectation is that it's going to be on your adult child. But again, go back to the fact that if we need supports, let's talk about putting these in place. Annie?
Thank you. Next slide. So we have a couple of resources that share the differences between pediatric and adult care. This one is made for youth. It shows aspects of what their care is like now. So in that first column, pediatric care, where you are now. And then they can see on the right-hand column, they can see how it'll change when they move to adult care or an adult approach to care. And so the idea is that they can, they and their parents can look at this and just see what's going to change when they move to adult care. If they have any concerns about any of this, bring these questions or concerns to their doctor so they can discuss them. We say doctor, this could be a doctor as well as another type of provider, like a care manager, social worker. And it also has some tips for preparing for the move to adult healthcare that are just bulleted there on the right. And then if you go to the next slide, there's one more tip sheet that lays out a comparison of pediatric and adult care. This gives detail, some more detail about system differences, such as on the pediatric side, it focuses on the youth's growth and development, whereas when they become an adult, it's about maintenance of well-being with aging. And so again, it's a way to compare the differences and then bring any questions that they have to their appointment and to be able to ask questions. Next slide. So this is the last question. How ready is my child to transition to adult care and manage their own health and healthcare?
So for time's sake, I want you guys to see some of the tools we have. Again, it depends on your individual child, and Annie is going to talk about some of the resources that are available to help you determine what they may or may not need and what supports they want to explore. Annie?
Thank you. So this transition readiness assessment comes from Got Transition's 6 core elements of healthcare transition. It's an assessment that parents or caregivers can fill out to see what skills they think their child already knows, what they might want to work on. And there's a youth version as well that they can fill out, and you can compare your answers. And just a few examples of the skills under my child's health and healthcare. My child can explain their health needs to others. My child knows how to ask questions when they do not understand what their doctor says. So these are just a few examples of healthcare skills that throughout the transition process, the youth can learn to the best of their ability how to manage their own health and healthcare. And then on the next slide is a version that was customized by the American College of Physicians for youth with intellectual and developmental disabilities. This is a version for their parents or caregivers. It has some similar questions, but it also has some questions about decision-making and guardianship and personal care. And next slide. So here is another way to test how ready you are to transition. These are a couple of quizzes that are available on our website. One is for the youth, new adults, one is for parents. And it just asks some questions that are similar to what was in the transition readiness assessment. And then depending on how you answer the questions, the survey will end with links to several resources that can be useful. Next slide. So I'll just show you where you can find the toolkit. If you go to gottransition.org, we have a page dedicated for parents and caregivers. That's what it looks like. Next slide. If you scroll down on that page, you'll see all of these resources. The family toolkit is up there on the top left corner, and it's available in Spanish as well. Next slide. We also have some frequently asked questions about healthcare transition related to some background information about transition. So what are the 6 core elements? There are some questions about taking charge of your health, navigating the health system, and visiting the new adult doctor. Next slide. These are just some helpful resources. We linked to the family toolkit. We linked to the video that I shared with you earlier. And there's another video about what a joint telehealth visit is. This is when the pediatrician and adult provider are both present over a telehealth visit with the youth and their parent or caregiver. It's a chance for the pediatrician and the adult provider to talk and make sure that the adult provider has all the information that they need when the youth transfers. And then the steps for a successful joint telehealth transition is a social story that describes what that visit is. So those are our slides. Our contact information is here for you to contact us with any questions. But if we have time for any questions, Dawn, are there any questions?
So I'm also going to be launching the poll that I had mentioned to you all so that you can just go ahead and answer some of those questions. And myself as well as the team that's on have been answering some of the basic questions. The biggest ones were the ones I did give Erin. Someone's asking about where they can learn more about the differences between guardianship and shared or supported decision making. And so we answered that in the chat for them to find information. So, you know, this particular workshop is a region workshop. So there are people on this workshop, this training that are all across the region in the Northeast. So that's why we did mention that if you go on parentcenterhub.org, you can find the Parent Center in your state, and they have plenty of resources as well as the resources that Annie and Erin had shared as well. But if you have a question and you want to put it in the website right now, we do have just a couple minutes left. We can answer that for you, or you're going to get the resources along with the copy of the PowerPoint that has Annie and Erin's emails. You can certainly reach out to them. Actually, let me put it in the, I'm going to put it in the chat box right now.
I did see someone commented it would be nice to have a toolkit for doctors, as well as how to help folks with disabilities, especially IDD. I just want to mention there are a few tools that are available on our website. I'm putting the link in the chat, but there are a few tools that are called Integrating Young Adults with Autism Spectrum Disorder into your practice, and Integrating Young Adults with Intellectual and Developmental Disabilities into your practice. And those have some tips that are specifically for adults, healthcare clinicians, about providing care for this population.
And that is a common complaint that we hear from families, that there's not enough providers out there that understand our youth and young adults with disabilities. Someone is saying, is there information on how to handle refusal of basic care, like vaccines, dental care, blood draws, etc.? What if someone is very impacted and refuses essential care? Well, I mean, if a parent has guardianship, Erin, you can chime in, but if they have guardianship, the guardian makes the decision whether they receive that care or not, correct?
Well, it also depends on your state. So for example, in New Jersey, when it comes to psychotropics and medications, beginning around age 14, youth have some say so. You need to go to your state PTI. Also, all of your states will have a protection and advocacy organization that you can outreach to, because if somebody is refusing something that is life-saving or life-threatening, there might be some things that you can do. There's emergency, you could sometimes petition the court for an emergency conservatorship, sometimes, things like that. But again, the states have a lot of sovereignty. So go to your state PTI and also your state protection and advocacy. If you go to your PTI, on that parent hub will show you, they can help you find your own protection and advocacy in your state if you can't find that.
So we use ask your doctor a prescription for which numbs she's just saying, I'm sorry, Lauren's just saying what they use to make blood draw less uncomfortable. It numbs the area. Thank you, Lauren. Several Boston area healthcare systems are collaborating in developing a healthcare transition process at their individual systems for NDD patients. Have you been approached about working with the individual healthcare groups throughout their NDD transition process development? I'm not really sure what that means. Do you, Annie?
Sorry, I'm not quite sure either. If you want to email me after, I'll put my email again in the chat. I can connect you with the right person who can answer that question.
So Jennifer is saying, what happens if the young adult with DD is unable to act independently in an emergency? Is there a temporary process to give the decision back to the parents? So are you saying if, I guess that you don't have guardianship, you use supported decision-making, is there a temporary process to give the decision back to the parents?
So there's really not. If there was a crisis, obviously, you could call 911. Again, if something's life-threatening, if someone's, a threat to themselves or others. But I think that that's the point of why you really want to look at supportive decision making and look at, even when I talked to you about that PAD, that advanced directives, because you need to be proactive, because when you end up in a situation like that, you don't want to end up having to have the police be the decision makers, and suddenly somebody is, forced to go to the hospital or forced to go for a psychiatric evaluation. I think that the point of this and these tools, and especially please go on the gut transition because you can find resources for your doctors as well, is to put it on the radar before we're in those situations where our children who we love are now adults and we're in really bad situations because we were short-sighted and made no plans.
Someone said, I heard that Valley is here in New Jersey, is working on getting a group of doctors for special needs children after they age out of pediatricians. I haven't heard anything about that. I don't know if anyone else has.
No, I haven't. And I do know that there's a couple states, I know down in Delaware, there was actually a hospital there that has actually allocated specialists that have worked specifically on transition for specialties. But again, I think one of the things, that's why it's important we have these conversations and that we're involved in these so that we can start sharing, because we're not there yet, folks. I mean, especially if you have a child with a intellectual disability or a developmental disability, and they have the comorbidity of a health issue, you need to do some planning, because we even see sometimes discrimination. It's not okay to discriminate and say, we're not taking, oh, he's autistic, we're not taking him, and it's a specialty. That's the same as somebody discriminating against someone because of their race or their religion or their ethnicity. And I think that we have something called the Bog Center that also has tools you can look at for doctors. But I can say that I think that these types of resources and conversations, while they're hard and uncomfortable, are important. And I encourage all of you to reach out to your PTIs and your state organizations and let your voice be heard and let those barriers be heard and see what we can do to continue to improve outcomes for our youth as they transition. And Dawn, I am so sorry, but I have to go. I have another appointment.
I know, you're not the only one.
Very sorry.
But we're going to end. Roberta just is saying that this process is important and can be so overwhelming in the education realm. So it's in the chat. You all can read that. But I want to thank Annie and Erin so much for joining us today. Hopefully, I put the link in the chat for the resources. I will email that out with a recording. And I hope that you all are leaving with a lot more information than you came on with, and understanding the importance of this topic. So thank you again very much for coming and joining us today, both of you, the presenters, and we really appreciate it. And that you have our contact information. So if you need anything, please reach out to us. Everyone, I hope you have a wonderful day. Thank you, everyone.